Welcome to the American Institute of Healthcare Professionals videogram on caregiver burnout. And we're going to use this video in particular in conjunction with GC 720 and Alan Wolfert's textbook, as well as for PT 450 for those in pastoral thanatology, because caregiver burnout is a big reality that many individuals totally thrust to the side. They put their own health, their own mental well-being to the back burner and wear themselves out. And this can also be the case for family members caring for someone who is terminally ill. So burnout is something that needs to be addressed, because if you yourself burns out, how are you going to be able to help other people? So it's very important to take care of oneself. Burnout happens to a variety of professional groups, caregivers, nurses, healthcare workers, chaplains, clergy, any type of mental health care professional, group support leaders, which is the primary focus of our GC 720 course. The fact of the matter is, emotional pain of others has a cost. And that's important to remember, even if it's not your emotional pain. When you become empathetic and a sojourner in another's pain and grief, you are working with them to heal. And part of that healing can drain you, can take your energy. And upon hearing these stories, it can take a toll on you physically, mentally, and also spiritually. Things that you see, things that you hear can all take effect. And in some cases, you might go home thinking, wow, if this happened to this particular individual, could this happen to my son or daughter, or my nephew or niece, or my wife, or whomever, your husband? If these things can happen to people, you become more open to the fact that it might happen to someone that's really within your inner circle. And when this occurs, it can cause problems in your own mental health and your own ability to be fresh and objective when dealing with others in the profession itself. So it's important to take care of yourself, not only physically and mentally, but also spiritually. Benefits of self-care include happy life, recharging, and believe it or not, better care. By taking one less patient a day, you might be able to give better care to all the others the next day, just by simply limiting yourself and understanding that while you want to be able to help everyone, you have to be at your best to be able to help everyone. So it's critical to recharge, to take time off, to look after yourself, spend time with the family, to take a vacation, and not to feel guilty that you weren't able to help one person out of many, or able to see that one person. Because you have to look in the mirror and see, how are you able to handle it? And it's even more difficult for family members who are caring for those individuals who are experiencing terminal illness, and they're constantly caring for that individual, and they feel guilty. They can feel guilty if they take one day off to go for a walk, to go to a park, to go out to dinner, to go see a friend. They feel obligated that they have to be there every single time, every single moment of the day. And that wears on that individual. It can also cause resentment, guilt, and a variety of other side emotions. So it is important to understand that an individual, as a caregiver, whether professional or one caring for a family member, you can't feel guilty, you can't feel bad about recharging and taking care of yourself. For those of you that are still working, Wolfert mentions an idea of working smarter than harder. Number one, specific personal and professional goals should be set. You can write them out at the beginning of the week, per day, what goals, or you can also set them out the day before. And this helps you understand what you need to do visually, and the power of just crossing something off and not overloading yourself, not allowing yourself to be overloaded for this day, and to know that you can take a breath. And in a way, it's a way to better manage time and manage stress as well. Second, avoid interruptions, delegate tasks, and ensure support. So when you're working with one particular task, interruptions can be derailing. They can also cause stress. Taking on too many tasks and not using the staff and resources at your disposal can sometimes cause extra workload stress. So it's important to ensure that support and to be able to give 100%. And finally, number 3, according to Wolford, take a break when needed and avoid overloading oneself. And a break can be just 5 minutes in between patients, or it might end up having to be taking the weekend and not taking the work home with you. And I know, again, it's very hard as professionals who care about their patients, but if you can't take care of yourself, you're not going to be able to give those patients what they need. So Alan Wolford actually listed a manifesto for bereavement caregivers, which has indeed 6 or 12 total beliefs that as a caregiver you should take to yourself and really live by. And we're going to go through these here, and I think they're very, very important. One deserves a joyful life is the first point, and that's for everyone. But caregivers, sometimes they work so much, nurses included. They take long hours, extra long shifts, and they begin to fall into the mold of that. My life is a life of service. I don't do anything fun ever. It's always work. So you have to believe, to avoid this burnout, that you do deserve a joyful life. One's work, the second point, does not define self. You are whoever you are, you were born to be. After you clock out, you're not necessarily a nurse anymore. You're yourself, and that's okay to be yourself. You are a nurse, but at the same time, you're at home. You're your own person. You're not maybe a counselor or a social worker. Maybe you're just mom or dad. Maybe you're just the spouse. And that allows you to leave that atmosphere of what you were in and to decompress. And hopefully the home life isn't stressful either. Third one is oneself is not the only source of help for an individual. And sometimes with hubris and pride, we assume it's only up to us to take care of this. Sometimes it might be out of just over concern and feeling that it's all up to you to be able to help someone. We have to understand that we're not perfect and that other individuals might have better abilities to help an individual. And it's not giving up on someone, but it is just finding someone better equipped to do it. And if you're a home caregiver, that's also important. Maybe a person's terminal illness has gotten beyond, it's progressed beyond your skill level, and you need help. You need hospice or palliative care maybe, and you need to call these services in. Fourth point is one must maintain healthy sleep, diet, and exercise habits. So like a classic individual who doesn't believe they have a joyful life, or they believe that their work defines themselves, we find these individuals also having no time to eat. They're eating on the run. They don't take a proper lunch. They don't find time for exercise after work. Everything is about work and the profession. And in that, sleep, diet, and exercise become neglected. And then physical degradation occurs where you're no longer capable to do what you're doing because you didn't take care of yourself physically. And like we said, it's about caring yourself physically and mentally and spiritually. Another point, number 5, is one can become over-involved, and this can lead to neglect to self as well. And this is more of a broader term than just exercise habits, but one's whole self. Number 6 is one must maintain certain boundaries with others. And this comes across as to almost any type of personalities that we come across in work. Individuals might want more from us. They might want certain help in their mental healing, and there might be certain boundaries you're not willing to cross, professional boundaries that cannot be crossed. There might be boundaries with coworkers who try to push more on you than you're able to do. There might be boundaries with who you're helping. Maybe it's just as a friend and you're being taken advantage of. So it's important to know these boundaries and to hold strong to them because it's part of a healthy lifestyle. It's okay sometimes to say no. And sometimes it's important to say no. And if you don't, it can lead down to a slippery slope of getting more and more stressed and more fatigued, and then eventually more and more prone to sickness and illness. Go to the next six of the column. Number 7 is oneself is not perfect in anything. And a lot of times individuals who are professionals are perfectionists. And if they do one little thing wrong, they overanalyze it. And that can lead to issues as well. We try our best to what we know at a given time, and we are good at that, but we cannot be all seeing and all knowing or omniscient to the situation itself. One must practice good time management is number 8 as part of Alan Wolford's manifesto for bereavement caregivers. And time management allows us to, again, not only care for multiple individuals, but also to find that very important time for oneself to practice physical, mental, and spiritual practices and health. One must set limits on stress is number 9. And how many times with work overload and so forth where we start receiving multiple stressors, more than one, and then they start to collide whether we're at home or at work. So it's okay, again, to set limits to avoid that type of stress. Number 10 is one must listen to the inner voice of fatigue. And you know, when you hear that in particular, you feel tired, but yet in the evening, maybe you're being called to do something and you're just not there to do it. And the fatigue is gradually wearing you down. And it becomes almost to a point where you start achieving what they call a sleep debt, in that you're not regaining the sleep you need the night previous, and then it carries on to the next and the next and the next. And then next thing you know, you have maybe a breakdown or a physical illness occur because of that. Number 11, one should express their true self in work and play. And I think that's important in life itself. People tend to sometimes masquerade and pretend to be someone else, trying to put on a front or so forth. So it's important to be you, but also perform what needs to be done. And finally, number 12, one should not ignore spiritual needs. And I've been emphasizing that throughout these 12, that it's not just a physical, mental, emotional thing, but it's also very much a spiritual thing. And by spiritual, I don't necessarily mean religious. You can be non-religious and spiritual, or even an individual that might not have many metaphysical beliefs at all, but you have a world of values that you ascertain to. And they are important to follow. And they're an important part of what makes you you. So these are the 12. They're also found in Wolford's text. And if you find yourself maybe neglecting one of these, maybe it's time to start redirecting your energies into fulfilling these 12 standards of the Bereavement Caregivers Manifesto and implementing them in your life so that you can have a more productive, not only productive professional career, but also a healthier life itself. We offer here at AIHCP a grief counseling certification. Our phone is 330-652-7776 and an email at info@aihcp.org. In addition to our grief counseling certification, we also have a pastoral thanatology certification, as well as our grief support leader certification, which is a secondary certification that serves as an extension of the original grief counseling certification itself. I'd like to thank you for listening and like to remind everyone, whether you're helping family or whether you're a professional working with multiple patients or a nurse on, on whatever type of floor you're working on, working long hours, I just want to remind everyone that self-care is so important, not just to your own health again, but also to your professional performance. And it's something that you cannot make secondary. I'd like to thank you for listening and have a good day.